Hello, it's Bruce Williams, and today I would like to present part 9 of my series on the gross pathology of non-human primates, and this lecture is going to cover the integumentary system. As I do at the beginning of all of my lectures, I want to thank my friends and colleagues who over the years have provided me images either directly or through online collections which allow me to put these lectures together. Our first image is a normal finding in Aotus monkeys. It's a collection of apocrine glands on the chest of male animals, which is called the chest gland. There's a similar collection underneath the tail, which is referred to as the subcaudal gland. Aotus monkeys use these not only in territorial markings, but it's theorized that the scent from them is readily recognizable and helps to prevent inbreeding among subtypes of Aotus monkeys in a local region. When we talk about rashes in monkeys, I will be the first to admit that I tend to get them confused. There are minor differences in distribution between the various diseases, but I find it sort of difficult to tell a rash from another rash. However, there is one rash that I think that I have deluded myself perhaps into being able to recognize grossly. And it's this particular one. We looked at it previously when we talked in lecture 1 about the pathogenic herpes viruses. And this is one that is what I consider the worst of them. Very pruritic, somewhat painful, a vesiculohemorrhagic rash due to simian varicella virus, or sebed herpes viruses 6, 7, or 9. The reason I think this is a little bit characteristic is the severity of the rash, and because simian varicella virus is very closely related to human varicella viruses that cause chickenpox, it reminds me of a long-term sequela to chickenpox, which you can see in older humans, known as shingles. Very painful, very debilitating, and this is just a very ugly rash. Of course, being a herpes virus, it will start out not as ugly. It will start out as vesicles that eventually will develop into something that is a little more flagrant, like this. This is an older picture, but chimps have a self-limiting varicella virus as well, called Chimp. Varicella virus looks a lot like chickenpox. Does not have the predilection as simian varicella virus will do to occasionally go systemic, resulting in necrosis and hemorrhage in multiple organs. Very limited, self-limited disease in chimpanzees, as chickenpox tends to be in humans. But remember, this herpes virus, after the disease goes away, will be living in various nerves of the body. And so you're never sure when herpes virus is going to reoccur under stress. Here's another classic rash disease, among other things that will cause in non-human primates, and this is measles. We've talked about measles before when we talked about the respiratory system, and measles is the result of captivity. This is an aerosolized virus which is due to the rubeola virus of humans. So humans are the reservoir. This does not occur in wild Old World monkeys or New World monkeys. Remember that Old World monkeys or macaques will develop the classic lesions of measles, which they share with humans, which will include a maculopapular rash, which is classically seen on the face, the ventral abdomen, and the inner thighs. Of course, we're not going to show you this in this picture of a young cyno monkey. We're going to show you the back. But when we looked at simian lentivirus, we also saw a rash that was commonly seen on the face, the ventral abdomen, and the inner thighs. Other things that you may see in Old World monkeys would be fever, conjunctivitis. Occasionally you will see respiratory signs due to the interstitial pneumonia, and rarely, in the absence of other signs, you might see Neurologic signs. Measles is well known for causing the occasional case of encephalitis. In most cases, you're really not going to see much of anything. Because it is a morbillivirus, which is prone to develop viral syncytia and inclusions if you're very lucky in the skin or in the lymph nodes, or maybe if you biopsy one of the Koplik spots, the white spots that show up in the oral cavity, you will see multinucleated cells with syncytia, which in this disease have classically been referred to as Warthin-Finkeldy cells. Okay, pox viruses in non-human primates. There are a number of pox viruses of note which we should talk to. Classically, like every other pox, they are going to present with lesions that have a raised appearance, proliferative on the outside. The oldest part of the pox is generally necrotic because that has succumbed to the cytopathic effects of the virus. When pox viruses, like most viruses, they want target cells, they cause tremendous proliferation of cells in the stratum spinosum, and you get a proliferative lesion. And then over time, those cells will rupture due to the large numbers of virus particles within the cytoplasm. Those are the oldest cells, and that's the center of the area. So that's why all pox sort of look the same. I use the morphologic diagnosis of proliferative and necrotizing dermatitis to cover it in just about any species, and if it's in another organ, like it's in the kidney or it's in the lung, then I just switch dermatitis to pneumonitis or nephritis. Okay, so let's talk about pox viruses in non-human primates. Here are a couple of old world monkeys with classic pox lesions as a result of infection by Tanapox, or what was called Ortecapox. That's O-R-T-E-C-A pox. And the reason it got that name was there were almost simultaneous outbreaks in the Primate Research Center in Oregon, Texas, and California. So you got Ortecapox. It also affects humans, which is somewhat concerning here because this person, I guess, was too tough to wear gloves. Hope they didn't get this pox virus. It's not a life-threatening pox virus. It spreads less quickly than other pox viruses, such as monkeypox. And the term that it has been given in literature, which gets very confusing, is benign epidermal monkeypox. Okay? It affects monkeys, sure. Epidermal, that's pretty classic for pox viruses. And benign, there's no malignant, so it's a terrible name, but you hear people talk about BEMP from time to time. And this is one that affects macaques and African non-human primates, as well as humans. And the lesions tend to be a little larger than you will see in other forms of pox virus in non-human primates. Pox viruses are often spread by vectors. They can be spread by biting insects of various kinds, needles. And here is a great case from Dr. Gary Basket many years ago, in which it was spread by a tattooing needle. And you can see the concept of progressive and lesser inoculation of the virus. So the first number got a lot of virus, and then it got less and less. Benign epidermal monkeypox, better known as Tanapox. Okay, another type of pox virus, an orthopox virus, that can affect a wider range of non-human primates, including old world monkeys, new world monkeys, and great apes, is true monkeypox. Classic pox lesion, but note they are considerably smaller than that which we saw with Tanapox infection. And this is a virus that is used as a proxy for smallpox in various investigations into smallpox disease. And Depending upon the route of infection, you may end up with a simple cutaneous infection like this, or if the virus is aerosolized, as it may be in research settings, you might end up with a systemic infection designed to replicate the infection associated with a much more worrisome and fatal virus, that of smallpox. In 2003, there was an outbreak of monkeypox in humans in the Midwestern United States, seen primarily in people who are keeping exotic rodents as pets. The spread was facilitated by the import of a number of African rodents, including Gambian giant pouch rats, rope squirrels, and dormice, and they were able to spread this particular agent to other rodents in captivity, including prairie dogs. And there are a number of people who keep prairie dogs as pets, and they unwittingly found themselves on the receiving end of monkeypox. And in affected monkeys, the most common sites are the face, hands, and feet, or the non-haired skin is pretty common with poxviral infections. But disseminated infections may include the mucous membranes of the oral cavity, the genital tract, and aerosolized infections, of course, will include the pharynx, larynx, remainder of the respiratory tract, including the lungs, the spleens, and the lymph nodes. A third type of pox virus that non-human primates are susceptible is seen in old world monkeys both from Asia and Africa, and is known as Yabbapox. This is not common, maybe historical, but this pox virus is somewhat different than the others because instead of affecting epithelial cells, it infects histiocytes. And the lesions that we see are subcutaneous nodules. These nodules are composed of large polygonal histiocytes with finely vacuolated cytoplasm, and will spontaneously regress over time, where they'll be infiltrated by lymphocytes, macrophages, neutrophils, and after regression, these animals have lifelong immunity. Most of them show up in the skin, often over the pressure points. Occasionally, you will see in baboons oral lesions associated with Yabbapox. Okay, in the lecture on disease of the GI tract, we looked at Papillomavirus infection, and baboons will get a cutaneous papillomavirus, which gives sort of these flat, pedunculated, often sessile lesions. And if you look closely, histologically, you can see changes associated with chondrocyte formation and intranuclear inclusions within the keratinocytes of the stratum granulosum. Cutaneous papillomatosis. This particular non-human primate is the sooty mangabey, and this is a picture that appeared on the cover of Veterinary Pathology back in the 90s. Sooty mangabeys are one of the animal models and are susceptible to inoculation with Mycobacterium leprae, the causative agent of leprosy. Leprosy is a terrible disease which within the last 20 years has lost a lot of its scariness because of the success of the new courses of antibiotics and triple therapies, which the bacteria is susceptible. Many countries have closed their leprosariums, including the United States, and this is a disease which stands an excellent chance of being eradicated within the next 20 years. The bacteria results in granulomatous inflammation primarily in the extremities because the bacterium likes a slightly lower temperature. So you'll see most of the lesions, okay, on the face, the hands, and the feet. It causes a profound Th2 response, so you see large numbers of macrophages without significant necrosis and with large numbers of organisms within them. Chimpanzees are also susceptible to infection, and here's a very characteristic lesion with depigmentation, a sort of clawed appearance to the hands, and ulceration. The bacterium that causes leprosy, Mycobacterium leprae, likes to invade peripheral nerves as well, resulting in a loss of feeling, sometimes contraction of the fingers, and ulceration. And the ulceration is not due to damage to the tissue by the organism. It is usually the result of a loss of feeling from damage to the peripheral nerves, and then the person or animal will traumatize these lesions without knowing that they have done this. And another image here from the ear of an affected chimpanzee. I know I shouldn't probably be showing histo in a gross lecture, but just a nice picture of the skin of an affected animal, the diffuse granulomatous inflammation, and these very large macrophages, which are just jam-packed with acid-fast bacilli, which are known as lepra cells. Very characteristic infection, affecting both the dermis and those peripheral nerves. Very important to the pathogenesis of this condition. An older picture, not a common lesion, but this is a condition known as Dermatophytosis. The lesions of Dermatophyllus congolensis may be seen in a wide range of mammalian species. They're all fairly similar. It is sort of a exudative epidermitis with orthokeratotic and parakeratotic hyperkeratosis. In non-human primates and in people who are occasionally affected, it is most often seen in association with immunodeficiency. In HIV-infected patients, it occurs pustules on the hands or feet with pruritus and some mild exudation. Here's an interesting lesion which mostly is confined to African baboons, and this is multifocal coalescing granulomatous dermatitis, usually seen on the fingers and the face, and the result of this is a particular fungal dimorphic fungus known as Histoplasma capsulatum, variant Duboisii, and it results in sort of nodules which tend to ulcerate on the hands, feet, the face, occasionally in the buttocks. So it's the non-haired skin pyogranulomatous inflammation. And the difference between this and usual histoplasmosis, here's the ulcerated lesions on the hands of a baboon, and the difference between this and traditional Histoplasma capsulatum is the size, with these particular yeast ranging up to anywhere from 8 to 15 microns, whereas traditional Histoplasma capsulatum usually you have multiple 2 to 4 micron yeasts within the cytoplasm of one macrophage. So this is much larger and a disease primarily seen in baboons. Here's not a great picture of this particular lesion, but and the animal's been tranquilized. It has a very odd look on its face. The condition that I want to discuss is a nematode parasite, which generally gets into the skin of the hands and feet and the respiratory tract, which is an aphasmid known as anatrichosoma. Anatrichosoma in non-human primates goes by two synonyms, cynomolgi as well as Anatrichosoma cutaneum. They're probably interchangeable. It's often seen it's an intraepithelial parasite, rarely goes into the underlying tissues, and it's usually found in the nasal epithelium of both old and New World monkeys as well as apes, but can cause cutaneous larval migrans, and it doesn't cause much of a problem. The infection in the nares is usually subclinical. You may have a little bit of serous discharge, and this is what it looks like within the epithelium of the nares. And this is not four worms. This is one particular worm that is multiple cuts throughout and can be somewhat difficult. The inflammation is somewhat characteristic, lymphoplasmacytic, rhinitis, but sometimes it can be difficult to see in histologic section. It's not distributed diffusely throughout tissue sections or blocks. And here are the lesions that are caused by the larvae as they migrate through the skin of the hands and feet. These serpiginous lesions associated with cutaneous larval migrans. Lice or pediculosis is not a commonly seen thing in colony macaques due to the grooming nature of macaques. Any non-human primates that are grouped together tend to have a fairly low incidence of readily available parasites. If it is seen, as in this case of a young macaque with Pedicynus longiceps, the louse, it's probably a young animal who is housed by itself and doesn't really have the wherewithal to groom themselves. But because looking for parasites and unfortunately eating them is a very common behavior in macaques. It's not something that you would, in non-human primates, not something that you would expect to see. An older picture, there is mange of non-human primates. This is caused by a condition, a mite known as Surrogates cercopitheci, and it causes a mildly pruritic and crusting lesion, not a common finding in laboratory primates. And finally, maybe doesn't belong in the skin, but it's here anyhow, and this is a focus of mineralization, granulomatous inflammation, known as calcinosis circumscripta. Not that different than we see in other species which are affected, like primates or dogs, often on the digits, and maybe the result of previous trauma, dystrophic calcification, and ultimately inflammation resulting in arthritis and other changes in the digits. Okay, well, that concludes our session on skin disease in non-human primates. I hope you enjoyed that. Our next lecture will cover the endocrine and urinary system of non-human primates. An interesting combination, but one that I think we can put together because I have a limited number of slides on those particular systems. Hey, thanks so much for tuning in today, and